Thank you for joining us in this very quick discussion about PDO threads and making the right FDA and clinical choices with PDO threads here. My name is Dr. Louis Maltzmacher, and I am a practicing clinician, president of the American Academy of Facial Aesthetics. There's my email if you need it for anything, and there's the AFE's email as well, and lots of different websites, resource websites that we have through the AAFE and associated companies that we deal with all the time here. And also, the reason that I'm making this is because we in the American Academy of Facial Aesthetics have gone ahead and done extensive research on PDO threads around the world. And also, we've tested them both clinically, and also we rely on others, some of their feedback for PDO threads and the usage of them. But we've also done a lot of research into the FDA, and I have sat on FDA panels and with some of the FDA medical and dental directors as well over time about different products. So the FDA is something that is very important when it comes to the proper choice for PDO threads and really any pharmaceutical and any medical device here. So here are the three levels that are well known for pharmaceuticals and medical devices here. So let's go through them briefly so you understand this fairly well. FDA approved. What does that mean? That is for class 3 medical devices and pharmaceuticals and other things. They need to be FDA approved, and that's an extensive and expensive process that takes years. One good example is botulinum toxin, and does not apply to PDO threads, which you will see is in the next category. And because this is a much higher level of requirement by the FDA, and it's typically, again, for class 3 medical devices and pharmaceuticals, but PDO threads, which are a class 2 medical device, do not need to be FDA approved. There is no such thing as an FDA approved PDO thread because this category does not apply to class 2 medical devices like PDO thread. So if you see a company that goes ahead and actually promotes and says that they're an FDA approved PDO thread, well, they're either misleading, they're either incorrect, or even worse, they're just straight out lying for you. So that you should not be seeing that, and if you do, you should really have a lot of questions about that company's PDO thread. FDA cleared is the proper category for this, and what that needs is something called a pre-market notification of intent, otherwise known as a 510K, so that the FDA, which has gone through the FDA to market the device because it is substantially equivalent to an existing cleared product. And PDO threads are really a suture material. Polydioxanone threads have been a suture material for almost 50 years already at this point in time for medical, dental, nursing. These are slowly absorbable threads that are used to approximate tissue here, and they break down over the course of a few weeks and a month or two for all of that. Now, how they work with in aesthetics is in the subdermal plane, the body's natural reaction is to go ahead and build its own collagen as this absorption of the PDO thread is going to break down. So that's how it works in the aesthetic field. But the only thing you need is an FDA cleared thread. That is the class that is in, and ideally, now this is really important, the FDA clearance for this should be on the PDO thread inside the cannula or delivery device, which can be a cannula or a needle, and the FDA clearance should cover both together as one single medical device. And that is true of a very, very few FDA cleared PDO, class 2 PDO threads that are available in the US. Most of the other companies, and there are only a very few companies that have any kind of FDA clearance, but most of the other companies only have it on the PDO thread. Well, when they put it into a cannula or a device, whether they do it at the time or whether they do it in advance, that's a really good question whether or not that is now a new medical device that may not have the same FDA clearance. So I'll leave that for the legals there, but that's certainly a point of contention potentially. And again, this is you're the clinician. You have to make the right choices for your patients. And then the third category here is FDA registered. FDA registered means nothing when it comes to PDO threads. Any company can register a Class 1 product with the FDA by paying an annual fee. Now, PDO threads are a Class 2, but some companies that sell PDO threads actually register them as a Class 1 product. And if you're using those, that is putting your license at risk. It very well may be putting your license at risk because you're responsible for what you are going to use. If they misclassify a product, that doesn't, the FDA may go after them, but your state licensing board is coming after you. If there's a patient complaint and they investigate and they ask you what you've used and it's an FDA registered device, then you certainly are going to have some issues and some problems. So those are the three categories in a nutshell for that. Now I'll just take you through a few more things here. And now this is in the AAFE's opinion. What do we look for? FDA cleared Class 2, known origin of the product. We know what the manufacturer is, and it's got to be one of the well-known manufacturers. Only 5 of them in the world that really are going to have an FDA cleared PDO thread. And the FDA does have requirements for proper packaging as well. So Vsoft Lift, Nova Threads, Mint, there might be a couple others here, and this may not be an all-inclusive list for us, but those are the only ones that we would be comfortable using. But again, to that one issue of FDA cleared in cannula as one single medical device, Vsoft Lift is the first one that really has that fits that bill for that. The other ones are only on the PDO threads in the top line. And I'll say just something about this slide. If you have any information or anybody wants to send me information, I'm always welcome. I'm always happy to update this slide. Now, everything else on this, again, in our opinion, and because we train thousands of healthcare professionals, dentists, physicians, nurses, nurse practitioners, and physician associates every single year. So we are not just worried about our training, we're worried about them when they get back to their practice. Everything else on this list may have some things, and we've contacted these manufacturers, and it may be FDA cleared Class 2, but we do not know the origin because, companies may say they're a manufacturer, but they, in essence, are not. They will not disclose where they get their PDO threads, and I can tell you from experience, there are PDO threads made in Korea or China in somebody's basement or garage, and without knowing the origin, I wouldn't touch a PDO thread for that, which should be disclosed on their 510K and should be disclosed in public records. And some of these may or may not be. Again, if you know information that could change this, I'm happy to update the slide. Or they have improper packaging, like what you see on the side here. Would you risk your license in a blank package with just a little sticker on it? The FDA does have proper packaging requirements there, as you can see on the right side of that. But the left one, I wouldn't risk my license for that, neither should you. And the other ones, FDA registered Class 1, certainly not advised, as we discussed already. And I can tell you the AAFE deals with all the licensing boards constantly on a constant basis with questions that they get about cases that come before them when it comes to injectables. And I can tell you cases, many more than what you see here. I'm just giving you the most recent, where an MD-NP were fined $135,000 by the state licensing board and the FDA, and a 1-year suspension, and for using blank products or products that do not fit the right classification that they should be using, and a recent DDS fine $55,000 and a 3-month suspension. It's your license that is at risk. So again, FDA approved does not apply here to PDO threads because that's not the category that they are in here. So let's go ahead and just talk about the individual products here, the ones that I mentioned, because really in the AAFE we would not be comfortable using anything else here. Vsoft Lift, Nova Threads, Mint PDO. Now here's the clinical part of that you need to be aware of. You want the strongest, you want to be able to use the least amount of threads for the maximum efficiency and the maximum aesthetic outcome for that. And that's going to be V-Soft Lift, and that's why we use it in AAFE trainings here. The lifting threads are the strongest. The smooth PDO threads produce the most collagen, and I'll prove it to you, not from, I mean, we've done our own research, but I'll show you what everybody else shows. The other ones, the equivalency, you need one V-Soft Lift for every 3 to 4 of Nova threads, for every 4 to 5 of Mint PDO threads, and that's not me talking, that's them talking, which means V-Soft Lift is the least expensive overall. They've got really a very wide range of available threads, but they're the strongest when it comes to lifting, and they are the best in collagen production when it comes to collagen production. And here is some of that smooth threads madness that you see all the time on social media, Instagram, Facebook posts. And I can't imagine why the people that that present this and use this and train on this think that this is a good thing. What does this tell me and what should tell you? If you need this many threads, you are using the wrong thread. This would be smooth threads for collagen production. If you need this many threads, you are absolutely using the wrong thread, because this is absolute madness. You want the least amount of threads, use the right product that produces the most collagen production, and that certainly is going to be V-Soft Lift, which again was why we chose it for AFE training. These are V-Soft Lift smooth PDO threads with AFE techniques. I mean, you need 3 to 4 or 4 to 5 times the number of threads, and patients, I don't know about your patients, but my patients, they can tolerate procedures, but I mean, some of what you see is just outstandingly crazy for that. And you can use smooth PDO threads, get a lot of collagen production. This is what we used on the patient on the left. We can show you her before and after, and this is after 3 sessions. Look at that beautiful cheek, not with dermal filler. These are with solid filler smooth PDO threads, the V-Soft Lift brand, and that's exactly why we use them here. And it gets even crazier when it comes to lifting PDO threads. Whether it's molded or barbed threads, it doesn't really matter. This is not the AFE, it's not V-Soft Lift. If you need this many lifting PDO threads, which is more of an invasive procedure, even though these are non-surgical procedures, but if you're putting in this many, you can count them up yourself. 20 on the side of a face, 10, 15, 20 on one side of the face. That is a lot of work, and if you need that many lifting threads, what does that tell you? The thread is not very strong, and that's why you need so many. You see it in on one side of the face, and you see the patient prepped for the other side of the face, and that is it boggles my mind that people need this kind of thing. Use the right tool, the right PDO thread. You need only 3 to 4, maybe 5 sometimes in a difficult case, or 6. They make a lot of different threads, V-Soft Lift. Some are heavier for heavier tissue that can do this, but you compare the difference. Again, here's another case and I'm only talking about the 3 top companies that we described before that we would even think about using, but here's another one, and they show this, their trainers show this, and I guess the manufacturers show this, and they're obviously proud of it to put it on social media. This is 20 threads on one side of the face, and it's a nice before and after. Is it worth 20 threads when you could be using 4 threads, 5 threads, 6 threads, whatever the number is? Many of our cases for V-Soft Lift are 3 lifting threads on one side of the face. That's the way that we believe it should be done. You want the minimal amount of threads, the strongest threads, the most collagen producing for the greatest aesthetic result. And that's exactly what we're trying to do here. And you get these kinds of results. And of course, we use total facial aesthetics. You cannot do total facial aesthetics without Botox fillers, botulinum toxins, so any of the toxins, well, we'll just call it Botox for short, Botox fillers and PDO threads together over time. This is a transformation that took 2 to 3 months to go ahead and do this, and she actually is an NP who is an AFE member, and no wonder, and she's got her own aesthetic practice there as well. So not only does she get the benefit of that, and obviously she did have botulinum toxin fillers and PDO threads, but then she pays it forward, and this is a patient of hers that she did so beautifully using botulinum toxin dermal fillers and PDO threads. But if you got to use the right techniques, that's going to be AFE techniques, and that you've got to use the right PDO threads. That's going to be VSoft Lift, in our opinion. FDA cleared class 2, properly known origin, the strongest, the most collagen production, properly packaged. That's what you want from a clinical perspective, an FDA perspective, when it comes to PDO threads. And I hope that you will consider AFE training because we've got the best techniques when it comes to PDO threads and botulinum toxin and fillers as well. So please go ahead and follow the AAFE at Facial Aesthetics on Instagram, Facebook, YouTube, and TikTok there. And also, we welcome you to any of the AAFE live patient CME certification trainings. We've got lots of advanced courses. We've got foundational courses in botulinum toxin dermal fillers and PDO threads, and a lot of specialty courses. And as you can see, the best cadaver lab that is out there with ultrasound training and so much more. And there, if you would like to contact me if you have any questions, or the AFE and all the different websites, that would be great resources for all of you. So thanks for listening to this. I really hope it helps you pick the right PDO thread for you and your practice here. But now at least you understand where it comes down clinically and from the FDA approach for PDO threads. So continued success to all of you. We'll talk to you all again real soon.